so much for joining us on yet another edifying edition of the program You're in Your Health at an Equinoxe Radio Multimedia. Today, we'll be looking at the HPV virus. Human papilloma infection is a risk factor for cervical cancer, the fourth most common cancer among women globally. Its burden is the highest in sub-Saharan Africa with over 90% mortality rate. What's this HPV virus all about? How is it spread? That's what we'll be looking at in today's edition of the program. And my co-host, AC Lucy Lengu, is also with me here in the studio. Hello, Lucy. It's always a pleasure being with you.
Of course, Immaculate Fogwe. It is a pleasure indeed. Good afternoon to all our listeners and viewers out there.
You have the privilege to introduce our guest on today's program.
Exactly. Our guest for today's program is no other person than Dr. Ahmed NFOR. He is a public health consultant and equally the board member of the West Africa Botanic Research Council, Ghana. Good afternoon to you, Doctor.
Good afternoon, AC. Good afternoon, Immaculate. It's nice spending this afternoon in this very wonderful program with you at Equinoxe TV.
It's always a pleasure having you on the program. Doctor, today we'll be looking at the HPV virus, and I would like to know, first of all, what's the human papilloma virus all about and how does it spread?
Okay, the human papilloma virus is a common virus which is common among animals, especially in human beings, very common. And it doesn't cause any complications, health complications so far because the immune system, our immune system is constantly fighting against this virus. Mm-hmm. So in most cases where people are infected with this, it goes without signals. It disappears with no signals. But in the case where people have broken immune system, that is, as we'll be talking, people are more prone to. People have broken immune system, that's where you can see their manifestation. The human papilloma virus is basically spread through, is classified under sexually transmitted infection. So it is it can be spread through sexual contact. It can equally be spread through skin-to-skin contact. People who are in prolonged contact with people who are infected, it can also be spread. We know, though it's not in the context of Cameroon, there's also what we call anal sex, when people copulate through the anus. This can also lead to the spread of the human papilloma virus. And equally, research has proven that traces of this virus can be found in urine, which means contaminated urine can also affect people, especially when we exchange dresses, which are inner ways. It can possibly be spread through this means. We also have the truth. Intimate kissing with people who are infected can spread the virus because there is mucus or saliva in the mouth, which can harbor some of this bacteria, and there's also mucus, and then wounds. You know, most of the time, our buccal cavity is always having some small ulcers or wounds, traces of wounds. This can also lead to the spread of the human papilloma virus.
Is there a possibility of seeing someone and just saying this person has HPV? What are the symptoms to watch out for? The
human papilloma virus is, in most cases, is asymptomatic, which means it's difficult for you to identify people who are affected with this virus. Okay. It's asymptomatic. But when the cases go too long, when it is it's a chronic infection, we can have bumps or lumps or growths around the genitals. And these painful growths which are very painful, like the genital wart. And we can equally have a watery, pale discharges, which have a foul smell. This is common in women. When you have discharges which look pale and watery and has a foul smell, there is an indication that you can be suffering from an infection from the human papilloma virus.
And before we continue, we'd like to give all the numbers for those who would like to join or partake in the program today. We have 670-547049, 670-547049, or 656-622-2222, 656-622222 at the end. And back to you, Doctor. How can this disease be related to the cervical cancer?
Human papilloma virus accounts for 90% of cervical cancer and anal cancer. Mm-hmm. And it also accounts for about 70% of vagina and vulva cancer. Vulva is the entrance to the vagina. And it accounts for about 60% of perineal cancer. That's cancer of the penis. These are all, when I say 90% accounts for cervical cancer, then you can know that majority of the cervical cancers are in relationship with chronic untreated human papilloma virus. This virus attacks the tissues of the cervix and gradually destroy the tissues of the cervix, upsetting them from their functioning. And when these tissues undergo this obsession, they now function very abnormally, and then they develop the abnormal cells that have been destroyed, multiply in their numbers, causing a bunch of cells at the cervical region, which can result to cervical cancer. This can take a very long time. It could take about 15, 20 years before it is detected. But as we said earlier, when you start having some of these symptoms were mentioned before, or you start having bloody discharges. It's not your period, but you see patches of blood coming out of your vagina or patches of blood coming out of your penis for men. You need to take note that this could be a sign of infection. And equally, when you start seeing discharges which are watery, milky, and having smell, you can start taking note, because it only goes to the cancer stage after it has been in the system for quite a long time.
Like how long?
It could take about 10 to 15 years before developing to cervical cancer.
Wow. 10 to 15
Can take about 10, 15 years. So in these cases, the symptoms, the signs and symptoms keep coming up, sometimes disappearing. And since we are ignorant of it, that's why the screening for cervical cancer is of only importance. That the women who are above 20 years above should do cervical cancer screening.
So what tests can be done to carry out to diagnose the HPV infection?
I think that the most common test which is carried at the context of Cameroon is what we call the DNA test and biopsy. Biopsy is like when we mentioned all the time about fungi with our biopsy, where they have to cut patches of flesh or tissues around the infected area, or the area we suspect. We have seen some signs and we are suspecting that it could be the attack of the virus, and then they analyze in the lab.
Right.
So biopsy is very common.
I want to understand, cut a part of the body?
The tissues of the areas which are affected.
Oh.
To analyze, because there are other symptoms and signs that could come up and which is not the virus.
Oh, okay.
So to carry out the test, you must scrape the tissues. Biopsy is scraping tissues.
It can be painful, right?
Normally it will be painful, but not much, because it will not take much time.
Okay.
The specialist doctor has to insert a dilating strip into the vagina. You know, the vagina is a long tube, and the cervix is right down there, which is like a door to the uterus or the womb. So he has to put some forceps to open up the vagina widely, and then send a soft tissue to scrape tissues from the cervix so that it can be analyzed in the lab. This is biopsy, is common. There's also DNA test, which is carried, and they will have the PCR test, which is also carried. But the one which is very common in Cameroon is the tissue, the biopsy, the tissue test.
Is there a particular age group that is more affected by this particular condition?
Yeah, I think talking about particular age group, I will also involve people who are more prone to this infection.
Yeah.
The particular age group is mostly people who are from 20 years below, or let me say 30 years below, because they are sexually very active. As we said, the human papilloma virus affects the genitals, the rectum, the anus, the vulva, the penis, and the skin around the vagina. Now, when you see people who are sexually very active, they may not pick it directly through sexual contact, through semen, or vaginal secretion. They may pick it through contact with the infected organs or the infected parts of the body. So young people are more prone to this infection, because as you grow up, the zeal for sex drop. And so also equally the possibility of you getting infected at age 2 also drop, because you are not very sexually active. You hardly see people of 45, 50 years sexually very active, but younger people are more sexually active. So the rate of spread or the rate of infection drops with aging.
But we should also understand that if you have the disease, let's say maybe you were infected from the age of 20, since it manifests like in 15 or 20 years, at the age of 40 or 45, you can still be infected.
Yes, that time limit I gave was a kind of an average time limit. It could manifest earlier than that. It could manifest earlier than that. It could manifest later than that. But this is like an average, that about 80 to 90% cases, they manifest this way. So those who have multiple sex partners, you can see how exposed they are also. And you hardly see a woman or a man who has 50, 55 years, 60 years with multiple sex partners, because the energy is not there to carry out the duty.
Is this condition very frequent in context of Cameroon today?
Yes, Cameroon is actually there in Cameroon, and we are witnessing cases in Cameroon mostly in people, in two groups of people. The first is people suffering from HIV/AIDS. Because, as I said at the introduction, is that the human papilloma virus is always there with us, but our immune system is strong enough to defend it and then prevent it from attacking our system. But now when you have HIV/AIDS, the human immunodeficiency syndrome, your immune system becomes weakened. And so this virus can easily get access and manifest. And now those who had that duration I was taking, they are people with strong immune system. Now the person with HIV/AIDS has a broken immune system, so the manifestation comes faster. Then another one, people using what we call immune system suppressing drugs. There are some drugs when you take, it weakens the immune system. That's why most doctors try to avoid this kind of medication. I give you one example of immune system suppressing drugs. You have the drugs that most of the young people are taking today, the tramox, the cocaine, and all those things. They weaken the immune system. And the marijuana, they weaken the immune system. So these immune system suppressing drugs weaken the immune system, and any least contact with the human papilloma virus, you can get contracted.
Now, let me come back to that marijuana and tramol, because a lot of people who take this, they seem to be so strong. They kind of, they have this courage. And how can you tell me it weakens the immune system?
Now, when somebody is physically very strong and energetic, it doesn't mean the immune system is equally strong.
Okay.
Strong and being energetic means is a mindset. It's a courage from the mindset. You could feel very strong, but you cannot withstand a fight.
Okay.
You feel within yourself you are strong, but you will not withstand a fight.
Okay.
So it's a psychological mindset which occurs mostly in those who take drugs.
I see. For those who would like to participate in the program, here are the numbers: 670-5470-49 or 656-622222. Those are the numbers you can reach out to this program and ask your questions. We know a lot of people are going through this condition, but they have limited knowledge on how to go about it. Here's the right moment, here's the right time for you to ask those questions.
Sure, and many people too are worried that we have heard all, let's say, the symptoms, we have heard about how it can be spread. Then now, let's talk about the cure.
Human papilloma virus is actually difficult to cure when it is chronic. At the initial stage of infection, there are possibility that some antibiotics could clear it off. That's why there is an emphasis of early diagnosis. When it is diagnosed earlier, it is easy for us to treat it. But when it becomes chronic, as we are saying that the moment it stays long in the system, it causes other things which are not curable. So it can be cured, but at a very early age. That's why since the most of the cases are asymptomatic, some school of thought seems to say that there is no cure. Because most often the symptoms comes when there is a viral infection and becomes difficult to be cured. But it can be treated to suppress the viral manifestation. Cured completely eliminating virus may be difficult at the chronic stage.
Then what about the preventive measures?
Well, preventive measures, when we're talking about method of spread, automatically we are talking about prevention. One of them is good hygiene. Since we're saying that this virus is among us, we need to take good hygiene. Women should take a bath at least 2-3 times a day, especially we're living in dusty environment, we live in dirty environment, we are in the context of Africa, we need to take bath 2-3 times a day. Men at least, if there's water scarcity, at least once a day. And then we are also saying that another way to prevent it is we should stick to one partner. I don't always buy this idea of people using condoms when we come to human papilloma virus. When you use condom, you are going to prevent the seminal transmission. That's transmission through the semen and the vaginal secretion. But what of the contacts? Because any copulation, when a man and a woman comes together, the vulva of the woman is directly in contact with the testicles, the testes of the man. And the condom does not cover the vulva, not the testes. So you see, you are still at risk. So completely, it's good to stick to your one partner, you are one legal partner, than using condoms. Another way to avoid it, to prevent human papilloma virus, is to carry out the damage of human papilloma virus is to do cervical cancer screening. for women because there's a vaccine you could take. If you test negative for the virus, there's a possibility of you taking a vaccine.
We have a call on the line. Hello.
Yes, hello, good afternoon.
Good afternoon, madam. Your name, where you're calling from, and your question.
My name is I'm from Bafmen, Mentum Division.
Okay, madam, go
I'm
ahead.
working at Equinoxe Division now.
Okay, go
I'm
ahead with your
working
question.
and I have about that is what I've been discussing with for a long time. See why the judges, at times I see wounds on my pelvis. In fact, it has many things to solve. I don't understand. I have been going to the hospital from one hospital to another, but I've not had the solution. So that is why I was watching. That's why I decided to call.
Okay. Lucy, you got the question clearly?
Yeah, I got the question though not clearly.
Me too.
She's expressing her worries that she's suffering from this condition because sometimes, like you mentioned, she sees blood on her pants and the rest. So she's wishing she wants to know how she can get cured from this infection.
That she has been seeking for solutions
Yes,
for a long time now.
but to
Until
no
date,
avail.
she has no solution, as you say.
Okay, since it's not easy to directly get in contact with the caller, but I think the caller is listening to us. I will advise the caller to go to a good hospital, like the Bamenda Regional Hospital. Because I think she's calling from the northwest.
Mentum
From
Mentum Division,
okay,
precisely.
from Mentum.
Yes.
Okay, he can go to the regional hospital in Bamenda for a good scanning,
Okay.
to do a good diagnosis, screening, and then take good medication. Yeah, because of your music, as we said, as time goes by, it becomes more complicated.
I see.
So I think that if she moves to the level, I don't know whether she has done that before, because actually, if it was diagnosed earlier, some of these things she's explaining here could have not been featuring up.
We have another call on the line. Hello. Good afternoon.
Hello.
Yes, sir. Good afternoon. Your name, your question, and where you're calling from to.
Yes, good afternoon, ma'am. Good afternoon, doctor.
Good afternoon.
Yes, this is Alex calling from Boya.
Okay.
Yes, doctor, I have a worry. I just want to ask her because I have a problem. Whenever I go to the toilet to pee, I see something like dryness coming out of my pipe. I don't know if it can be the disease you're talking about.
Like you see
Yeah.
what coming out? You got it? That question?
No, maybe AC has got it.
Can you repeat it? You see?
Something coming out,
Did you get this?
coming out like.
We can't get what we can't get
what-
what's coming from your private, from your penis. Can you
Something
repeat
comes
it?
It's slimy, slippery.
It's slippery.
Slippery.
A liquid.
Yes,
Okay.
yes.
All right, doctor, you got it.
Okay, that when he goes to urinate or it comes
See
out
something
even
slippery coming out. I don't know if he
Yes.
has a
Liquid.
foul smell. We don't know.
Yes. Okay. Now, slippery discharges in male can be a sign of so many things, and it can also be a sign of nothing.
Okay.
Yes, it can be a sign of nothing. There are some hormonal changes that could cause discharges in both male and female,
Yeah.
especially those who are in the middle ages.
Okay.
But that notwithstanding, this kind of slippery discharges could also be a sign of development of a thing like chlamydia. It could also be possible that is chlamydia. It may not necessarily be the human papilloma virus.
I see.
So it can be a sign of chlamydia or hormonal changes. Many women will witness this than men. When you see something coming out drawing like okra from your vagina. Yes, it's not something to cry for.
Okay. So now, Doc, you were talking about the vaccine. The Ministry of Public Health in Cameroon recently launched a campaign last year where they planned vaccinating children of about 9 years old to about 12 years old.
Sure.
And why this target population? Why can't they go ahead to vaccinate, let's say, people of 25, people of 26 who are already active? Because we know those are the people who are prone to this disease.
Okay, that's briefly just to come to that. You know, as we said, we live with human papilloma virus. And then we said the most active people who are prone to it are the younger generation. I think the ministry is targeting the innocent population.
Okay.
Because the adult population, if most of them who have been very used or versed with health talks, or they must have heard most of these things I'm explaining here, but those younger ones could pick them even from their mother or their father who is affected.
Wow.
You see that? It's something
How
that
how
can.
possible
How
is
possible is that?
We say skin to skin contact.
Wow.
Exactly, just we said. A woman with
sweat?
Imagine a woman with genital warts, which sometimes itches, and they with long fingernails, as most women are doing today, and happen to scrape